So in this video, I'll be taking you through the latest developments concerning the retrial of the nurse Lucy Letby. Lucy Letby is currently standing trial on one count of attempted murder. The information provided in this video is from the live reporting taken directly from inside the courtroom. Doctor Ravi Jayaram will continue to give evidence today, with prosecutor Nicholas Johnson KC asking questions. A floor plan of the neonatal unit is shown to the court. Dr. Jayaram has written two indicators on it in Nursery Room 1, circled A and B. A is where the incubator was located. B will become relevant later on. Dr. Jayaram tells the court, once a baby is stable, then the transport team is called, as it can take time for them to arrive. He says the medical team have to ensure the baby remains stable pending their arrival. A call to the transport service was made at 3:15 a.m. A record is shown to the court written by the transport team. The accepting hospital is Arrow Park. There is a summary of the resuscitation efforts, with intubation at 18 to 20 minutes of life and surfactant 35 minutes of age. An internal transport team note is made, quote, called APH NICU to check for a cot at 3:31 a.m. The transport team registrar relayed a message to be given to Doctor Ravi Jayaram, which was noted that Dr. Jayaram was agreeable with the plan of action. The plan for the Countess team for Child K was to insert UAC and UVC lines, take an X-ray to confirm the positions, give antibiotics and vitamin K. Dr. Jayaram says at the time he was in the neonatal unit at a nursing station with a telephone on the outside of and adjacent to Nursery Room 1. He indicates his position on the floor plan shown to the court. An observation chart for Child K is shown to the court, with hourly readings at the half hour from 2:30 a.m. Dr. Jayaram explains the various readings, including the incubator settings. The oxygen saturation reading is 94%. An intensive care chart is shown, with the first readings at 3:30 a.m. The leak 94 reading is referred to, and the VTE tidal volume of air going into the lungs. Dr. Jayaram says he was not aware of these readings at the time. He says those readings are calculated by the ventilator. He says it is important to have some kind of leak or the tube is too tight. He says the important thing is to ventilate the lungs, and in the context Child K was not needing high-pressure ventilation and oxygen saturation levels are good. He says intubation is a risk in itself. He says it is important to know about the leak, but the reading in isolation is not significant, and they would not act upon it if everything else looked stable. It would only be looked at as a reading if the baby was deteriorating, he adds. I don't normally look at the leak, to be honest, unless there's an issue with ventilation. A morphine sign-in chart is shown for babies on the neonatal unit. They include prescriptions for Child K, the first of which is at 3:30 a.m, signed by Joanne Williams and Lucy Letby. Dr. Jayaram says they wouldn't have signed it out if a prescription had not been written. He says he does not know whether that 3:30 a.m. time is the time the morphine is signed out by nursing staff or the infusion took place, but suspects it was the former. He adds morphine is for the baby's comfort, particularly after intubation. He says that is done as a matter of routine. Nicholas Johnson KC refers to the desaturation event for Child K. Dr. Jayaram is asked where he was immediately before. He says he was sitting at the nurse's station with his back to the wall. He says Joanne Williams told him she was going to update Child K's parents, likely with where Child K was going to be transferred. She said Lucy Letby was going to be babysitting. He says at this point, in February 2016, we had a number of unusual incidents with babies, and a number of colleagues had noted an association with Lucy Letby. I was sitting, and I will be very honest, I was very uncomfortable. I just had a feeling, knowing what happened before, and my internal dialogue was, stop being stupid, get on with your work. And I just wanted to go in and reassure everything was okay. It was around 3 minutes after Joanne left that I stood up and walked in. I went through the doorway into nursery 1. I came through that door and walked towards the incubator. The first thing I did was look up at the monitors. I saw child K's oxygen saturations were dropping in the 80s and going lower. Lucy Letby was standing at point B, next to the incubator. She was not looking at me. She did not have her hands in the incubator. She was facing in my direction, but she was not looking at the monitor. As I approached, I can't remember my exact words, but it was something like, "What's happening?" He says Lucy Letby said, "It looks like she's desaturating." What's of note is the monitors usually alarm if desaturation is below 90%. I didn't see if the button to suspend the alarms had pressed. Nicholas Johnson KC asks, "Was there a sound of the alarm?" Doctor Ravi Jayaram replies, "No." He says child K's chest was not moving well. He says the ventilator was still working. He says he took a stethoscope and now heard poor air entry. He says a systematic approach was taken to work out the issue. A is for airway, so there was a check with the ventilator, and Dr. Jayaram says the ventilator was working. He says an issue with the ET tube will present itself as desaturations over a period of minutes. He adds another issue would be if the ET tube position had migrated, including if it had been dislodged. He says one way to assess that is to disconnect the baby from the ventilator. Dr. Jayaram says the checking process is almost a reflex and takes about 20 seconds. He says there wasn't any obvious evidence Letby had interfered with the tube. He says child K picked up extremely quickly within a few breaths after the baby girl was disconnected from the ventilator and given breathing support. Mr. Johnson asks, how long was it there had been significant ventilation problems for child K? Dr. Jayaram says it would have been longer than 30 seconds, probably 30 to 60 seconds given the saturation levels were in the 80s. He adds the heart rate was normal. He says that would be before he came into the room. He says Letby was saying words along the lines of, "She's desaturating." He says it was clearly an airway issue, and what he found suggested was an issue with the tube. He says the suddenness of the desaturation would go against the tube blockage, and there was not a huge blockage he could recall. He says it is a possibility, but he has never seen a baby of child K's gestation dislodge their own tube. He says it would take quite a lot of movement for the tube to be dislodged. He adds the diameter of the tube would have no bearing of how the tube could be dislodged. Asked about the high leak reading, Dr. Jayaram says he does not believe the leak reading is significant at all in connection with the deterioration. He does not recall any call for help and was surprised the alarm was not going off. He says in retrospect he is surprised no call for help was made, considering a baby of child K's gestation. Dr. Jayaram says he could not say for sure when nurse Joanne Williams returned to the unit. Dr. Jayaram is asked to look at his clinical notes. He wrote at 3:30 a.m. sudden deterioration for child K. He says the desaturation was potentially life-threatening if not treated. The clinical notes add child K was reintubated by Dr. James Smith after a bolus of morphine. Dr. Jayaram says child K would have been hand ventilated at this time. He says they took the opportunity to put in a larger 2.5mm diameter tube. Good air entry is noted. Dr. Jayaram says the next issue was to establish UVC and UAC lines for child K. He says they are things that help but do not cause trouble if they are not achieved. A morphine infusion chart for child K is shown, with the time of the infusion noted as 3:50 a.m. Dr. Jayaram has signed it. He says he cannot remember which began first, the morphine infusion or the morphine bolus. Dr. Jayaram said he would have then gone to see child K's parents in the labour ward to relay events and update them on the plan. Door swipe data is shown to the court indicating this. He says he does not remember any other babies or parents that required his focus that night. A note on the transport team recorded Dr. Jayaram was, quote, keen not to miss window of opportunity whilst baby stable. Dr. Jayaram says he was keen for child K to be transported sooner rather than later. The transport team was recorded as happy for day team to go first thing. A record from the transport team states, 0555 call received from Dr. Jayaram, baby dislodged a tube and had to be reintubated. The note adds, OK for the day team to do the transfer. Mr. Johnson notes it also says, still no X-ray. Dr. Jayaram says he does not have as clear a memory of the second desaturation. He recalls there was one and says there was a concern the ET tube had gone too far down. A clinical note written retrospectively at 0750 by Dr. Jayaram is shown to the court. The UAC would not pass, so was not done, Dr. Jayaram tells the court. At 0615 began to have lower SATs. The line before that refers to left lung hazy. Mr. Johnson asks how Dr. Jayaram knows about that. He replies he would have had to have looked at the X-ray beforehand, i.e. before 6:15 a.m. An X-ray of child K with a timestamp of 6:07 and 23 seconds is shown to the court. Dr. Jayaram says the left lung shown on the X-ray looks slightly more hazy. He adds the baby girl is slightly rotated. The significance of that is potentially either infection or surfactant lung disease, he says. Dr. Jayaram says the saturations for child K dropped quite suddenly at 6:15 a.m. He cannot recall if he was in the room. He recalled he pulled back the ET tube slightly to see if that helped, but it did not. A blood gas reading recorded a higher level of carbon dioxide. He says the readings indicated a problem with ventilation. A fluid bolus was given to increase the low blood pressure. He says in spite of this, saturations continue to drop. He says the positioning of the ET tube looked correct from the X-ray. After removing the ET tube, child K was given breathing support and reintubated. Dr. Jayaram says at the time this desaturation was clinically explainable, with the hazy left lung noted. At 7:19 a.m, door swipe data shows Dr. Jayaram is heading towards the office part of the hospital. He says at this point he believed everything was stable and he would be preparing for the day ahead without going home. A couple of minutes later, Dr. Jayaram is shown returning to the neonatal unit. He says he has no recollection of the third desaturation. His clinical notes of the desaturation timed at 7:25 a.m. are shown to the court. The notes record a sudden drop in oxygen saturation levels and a drop in heart rate to under 100. He says it was noted that ET tube had migrated 1.5 centimetres further into child K than had been cited at intubation. He says this time they did not withdraw the tube. It was moved back and the heart rate picked up immediately. The note adds, now stable. Dr. Jayaram explains the notes recorded on current situation for child K, on ventilator settings, medicine, fluids, lines and results following the third desaturation. He says a CRP reading for child K of less than 1 did not rule out infection, but would not indicate it either. He says a higher reading would be more indicative of infection. The heart rate was regular 130, abdomen was soft, a positive sign. Left lung noted hazy. The transport team was due for 8:30 a.m. Door swipe data shows Dr. Jayaram leaving the neonatal unit at 8:29 a.m. A face-to-face discussion was held between Dr. Jayaram and the transport team. A further dose to support child K's blood pressure was added to the plan, along with more lung surfactant. Benjamin Myers KC, for Letby's defence, rises to ask Dr. Jayaram questions. Dr. Jayaram confirms he held a lead clinician role at the hospital, a managerial role, between 2009 and 2018, including the times of 2015 and 2016. He said he worked together with Dr. Stephen Breary on the neonatal unit and agrees that role involved discussions on funding and risk management. He says, ultimately, at department level, the buck stops with me. Dr. Jayaram confirms Dr. Smith was under his guidance when intubating child K, and the 2.5mm diameter tube was used first. He says it was more ideal, as the guidance is to use as wide a tube as possible. When the 2.5mm tube was not possible, the 2mm was used, which should be adequate for a baby such as child K's size. He says there is more likely to be risk of a leak, but it's a calculated value, and child K's ventilator requirements were not excessive. Asked why he did not take over the intubation process, Dr. Jayaram says Dr. Smith was an experienced trainee. Child K had a successful resuscitation and the procedure was not urgent. He says with a 2.5mm tube at that time, it may not have been possible to intubate child K due to it not passing through the cords. He says he may have had the same issue if he had taken over. He says it's important to note that with a size 2mm tube, child K was able to be ventilated. Dr. Jayaram agrees there is a potential risk of trauma during intubation, but there was no bleeding noted and repeat intubations were carried out without difficulty. Mr. Myers asks about surfactant. Dr. Jayaram says surfactant should be administered quickly within 30 minutes. He disagrees with Mr. Myers' suggestion it should be within 5 minutes of birth. Dr. Jayaram says the resuscitation process was carried out first. Mr. Myers says in the first trial, Dr. Jayaram said ideally yes in relation to surfactant being given within the first 5 minutes after birth. Dr. Jayaram emphasises the ideally and says that is not always possible. Mr. Myers says the surfactant is given at 2:45 a.m, up to 20 minutes after intubation. Mr. Myers refers to the intensive care chart with the 94 air leak reading at 3:30 a.m. Dr. Jayaram says it is a high leak, and if there was a difficulty with ventilation, then consideration would be to put a wider tube in, but the other reading showed child K was ventilating well. He says even now, he believes it would not have been appropriate, given the wider clinical picture, to electively reintubate based on that reading. He says the baby was stable, the ventilator settings were where they were, and there was nothing to suggest anything of concern. He says if he was aware of the leak reading, he would not have considered it important, as the baby was stable. He says we don't treat numbers, we treat the whole baby. He adds he would not refer to it as an air leak, but a leak around the tube. He says it would have been flagged up to him if there had been concerns by nurses. He says the size 2 tube was good enough to get air in her lungs, as the subsequent size 2.5 tube was with the same ventilator settings used as the 2mm tube. He accepts there is no leak with the larger tube, but does not believe it is clinically relevant. Mr. Myers says the acute deterioration happened with the 2mm tube. Dr. Jayaram says the issue is it was an acute deterioration. This situation, up to the point of desaturation, there had not been anything flagged up, and the nurse Joanne Williams had felt child K was stable enough for the nurse to leave the room. A leak would have led to gradual deteriorations with gradually increased oxygen requirements, he adds. Dr. Jayaram says child K would have had some potential for breathing for herself, but for a poorly 25-weeker gestation, that would have been limited, and that was why she was on the ventilator. Mr. Myers asks about the timing of the morphine infusion. Dr. Jayaram says, looking at the notes, he believes it was 3:50 a.m. Mr. Myers says in a 2018 police interview, Dr. Jayaram had told them child K was already sedated on the infusion. Dr. Jayaram says that was the case, he had told the police that, and having looked at the records since, he says the morphine was applied later, as the morphine was taken out of storage at 3:30 a.m. He tells the court the tube was in a very good position, and the chances of a baby dislodging the tube spontaneously, especially small, fragile 25-weekers, was minimal. He says that would have been further minimised if child K was sedated. Mr. Myers suggests it is an exaggeration to say it can take up to 2 minutes for a baby to desaturate to the extent child K was presenting. Dr. Jayaram has said in police interview, quote, at least 30, at least 60 seconds. Dr. Jayaram says it would usually be 30 to 60 seconds, and up to 2 minutes would be a maximum. Mr. Myers says that 2 minutes was suggested as an exaggeration in order to discredit Lucy Letby. Dr. Jayaram replies that would be Mr. Myers' view. Dr. Jayaram said when he walked into the room and saturations were down, he says there must have been a period of at least 30 seconds when oxygen was not being ventilated properly. He says the tube must have been out for a longer period. Dr. Jayaram says surfactant deficiency would not cause a rapid desaturation. He says respiratory distress syndrome will cause lower saturations, but it would be unlikely and very unusual for it, as it is evolving, to cause a sudden drop in saturations in isolation. Mr. Myers says infection is another possible cause, but does not say this was the case here. Dr. Jayaram agrees it could be a cause of many issues, including desaturation. Mr. Myers says a blockage of the tube or a tube not fitted properly can cause issues. Dr. Jayaram says in this situation, up to this point, oxygenation had taken place and there was chest movement for child K. A nursing note for Joanne Williams, child K's designated nurse, is shown to the court. Began to desat to 80s. Dr. Jayaram in attendance and on examination, colour loss visible and no colour change on CO2 detector. ETT dislodged, removed and reintubated on second attempt by Registrar Smith with 2.5 ETT. Large amount blood-stained oral secretions. Dr. Jayaram says it depends on where the secretions are coming from. He says it could be from some trauma during intubation, but it did not follow that the secretions would block the tube. He says it is not uncommon for there to be a little blood trauma. He adds the comment is made after the second intubation, and there is no comment about bleeding on the initial intubation. He says if a blockage is suspected, you look at the baby. You look for chest movement, check for CO2 coming out. An X-ray can be carried out but is not viable in an acute deterioration. He says if there is a blockage, you notice it, and they don't happen acutely. Mr. Johnson rises to ask where in the nursing note there is a reference to a blockage. Dr. Jayaram says there was no evidence of any pulmonary hemorrhage during this process, and said if there had been anything that needed a closer look, he would have done so. Mr. Myers says Dr. Jayaram did not check the tube. Dr. Jayaram had earlier said he had a glance at it. Mr. Myers says there were blood-stained secretions. Dr. Jayaram says that was post-reintubation. Asked if Dr. Jayaram had contradicted what he said in a witness statement, Dr. Jayaram replies, it's a nuance, and said he did not formally look at the ET tube. Dr. Jayaram says it would take a big effort and quite a lot of strength for a baby to dislodge the ET tube, and had never known of a baby of child K's gestation to have done so. He says it is not impossible for it to happen. Mr. Myers says it is Letby's case she does not recall this incident, and he says whether it did or did not happen, Dr. Jayaram has added details to make it sound suspicious. Dr. Jayaram agrees that by this time on the neonatal unit in February 2016, there had been a number of unexplained deaths. Mr. Myers says a review was conducted into this. Dr. Jayaram says Dr. Breary had been involved with the review, he was aware of it, and it was noted that Lucy Letby had been present for all the deaths. Dr. Jayaram said he, Dr. Breary and other clinical colleagues were aware Letby had been associated. He said the unthinkable thought Letby was deliberately harming the babies was made. He said he wanted to, quote, reassure myself when we went into the room, to give my head a wobble and then sit down afterwards. He said the thought of deliberate harm was something we had started to consider. Mr. Myers said that possibility included killing them. Dr. Jayaram replies, yes. Mr. Myers says it is known Dr. Jayaram was on the telephone at 3:41 a.m. to the transport team, as shown by a transport team record. Mr. Myers says it is also known Joanne Williams returns to the neonatal unit at 3:47 a.m. Mr. Myers suggests it was about 3:30 a.m. when she had left the neonatal unit. Dr. Jayaram replies, I don't think it was as long as that. Dr. Jayaram says his recollection was that it was a short period of time before he went into room 1 after Joanne Williams had left the unit. Mr. Myers says, "Why didn't you check all the nurseries Letby was in if you were worried?" Dr. Jayaram says that's a good question. He says it's an uncomfortable thought. You don't want to think it. You want to bury your head in the sand. And the only reason I wanted to walk into the room was to prove I was being ridiculous. He adds at this stage, discussions have been taking place with Letby's managers, and it was, quote, impractical for him to follow Letby around, and it wasn't his job to do so. Mr. Myers says, at this stage, you've got her. Dr. Jayaram says at the moment he walked in, child K was desaturating, and that could be due to a dislodged tube or a tube blockage. Up to that point, she had been stable, and the alarms had not sounded, and no one had called for help. He said at the time the important thing was to deal with the baby. Benjamin Myers says, you were presented with the fact the tube had been dislodged deliberately. Dr. Jayaram replies, that was one of the possibilities. I was extremely uncomfortable. I didn't see the tube being dislodged. An ITV interview with Dr. Jayaram is shown to the court concerning the case of child K. In it, he says the event is etched on my mind, and the only possibility is the tube had been dislodged. Dr. Jayaram says the interview is a long time after the event, and after Letby was convicted of murders and several attempted murders. Mr. Myers says, you caught her red-handed, didn't you? Dr. Jayaram says the culture of the NHS with clinicians by this time, there was a strategy to keep us quiet. People didn't really want to listen to us or acknowledge our problems. He says if he had rung the police, they would have spoken to bosses and they would have replied to ignore the clinicians. He said we spent a long time trying to raise concerns and running into walls. He adds, had I had more courage, maybe I would have picked up the phone and called the police. Mr. Myers said, and what stopped you from doing that? Dr. Jayaram said adherence to procedure in terms of raising concerns with bosses. He says he had faith in the system at the time, but a meeting was not held for 3 months. I guess we put faith in our medical leaders at executive level. He says the police would have got in touch with hospital executives and they would have said it was already in hand. It had already been raised internally. Mr. Myers says Dr. Jayaram didn't contact police because things didn't happen the way he said they did. Dr. Jayaram replies, I disagree. There was an element of denial. I didn't want to believe what I had seen. There was fear of retribution. We were told it would have been inappropriate to contact police by hospital bosses. We were advised from the start contacting the police would be the wrong thing to do. He says in retrospect, it would have been the right thing to do. Dr. Jayaram says he found it beyond coincidence that with the alarms not going off and seeing Letby standing there as child K was desaturating. He says no matter what else they could have done better, it still strikes me at that moment in time. Mr. Myers says the issue of child K was not raised with police until June 2017. Dr. Jayaram says that is when the police investigation started. Dr. Jayaram says there was no precedent for Letby, and knowing now he would challenge the hierarchy. He says at the time the tube being dislodged was one of the possibilities. Dr. Jayaram said he had discussions with Dr. Breary a few weeks later about the neonatal unit. Dr. Jayaram says at the time he cannot go throwing around accusations about Letby. He says, we don't believe that people who work in healthcare go to cause harm, and I think I was a victim of my cognitive dissonance. Mr. Myers said he didn't engage in such a conversation with Letby, and she continued to work the remainder of her shift without informing anyone else. Dr. Jayaram replies, what am I going to say? Hey everybody, this is what's going on. Dr. Jayaram's clinical notes are shown to the court, which Mr. Myers says does not record the tube being dislodged. Dr. Jayaram says the thing at the forefront of his mind was the stabilisation of child K. He added he had mentioned it to the transport team. He accepts it is not in his written notes. Mr. Myers asks about the alarm system. Dr. Jayaram says he is absolutely certain it was not sounding. He is asked to look at a 2018 police interview at Blackham Police Station, and at the time he said he couldn't remember. Dr. Jayaram says, I don't know why I said that. He says if the alarm was sounding, he would have been alerted into the room. Mr. Myers says Dr. Jayaram said for a second and third time later that interview, He couldn't remember if the alarm had gone off or not. Dr. Jayaram says with absolute certainty it was not an alarm sounding that prompted him to go into the room. The ITV interview had Dr. Jayaram saying of the night February 16th to 17th 2016, "That night is etched in my memory. It will be in my nightmares forever." Dr. Jayaram says he wished he had the courage to escalate it in a different way, and that is why the night will be in his nightmares. Nicholas Johnson KC for the prosecution is now asking questions. Nurse Joanne Williams' note for child K is shown to the court. Mr. Johnson refers to ETT dislodged. There is no mention of blood, is there? Dr. Jayaram replies, no. Mr. Johnson asks, where would she know the tube was dislodged? Dr. Jayaram says Joanne Williams would have been more likely to look at the tube as he was busy resuscitating child K. Mr. Johnson refers to Dr. Jayaram's police interviews about the ET tube. He says in a 2018 police interview, Dr. Jayaram had said the tube was not blocked. The judge says that completes Dr. Jayaram's evidence. That also brings a close to today's proceedings.